So I think actually the product that will come out of this is the minimum viable product for a e-health secure platform that providers and patients can communicate with one another, provider to provider, patient to patient, patient to provider, and vice versa, in a secure fashion in near real time in an asynchronous environment that is protected from discovery and feeds and pulls from existing health records. It'll be a lot like an app or an iPhone or an iPad application that you can go on and give the permission to that app to use your data. It will pull the data for you, and it'll be like your own health record that you can then assign to some other provider. We did face challenges. The challenges were well understood by scoping the project early to be just what we call the minimum viable product, to make it exactly what we needed, but to describe an architecture that was an open and broad-banded architecture. Think big thoughts, start small, scale fast, get to the big thing later. We're actually quite interesting. The interaction between the physicians and the programmers was actually extraordinarily rich. The dialogue around data and data architecture was very rich. And the way that the project team was able to huddle and adjust, shift and pivot to make things work well was a welcome event for us in healthcare. I think one of the biggest lessons is how can we actually in healthcare take the innovation and the needs that we have and drive them very quickly into a workable product. And I think that method, the methodological learnings, are probably very unique in that as we go along. From a technology perspective, I think we'll be able to have this so-called horizontal platform in good shape for many other subject matter packages to be shoved down that platform. I think the coming together of many different people from many different disciplines, both vendors internal and external to the system, and people from the home office and from our local environment, clinicians and programmers, data geeks, and people who are patients came together and worked in a very collaborative and constructive way. And I think that's a wonderful lesson to be learned about what we do, and I hope we can actually codify that, learn from it, and continue to do these collaboratories in a very productive and quick way.